How does hypnosis really work? So I'm here with my friend Dr. Bill Anapel. He's a hospitalist at a busy San Diego hospital where he works with patients using hypnosis, and he's going to explain some really interesting facts to us. Okay, Bill, so straight off, is hypnosis mind control or not?
Hypnosis is not mind control, but it does have an effect on the control of the mind. How's that?
That's,
Um,
yes,
I
yeah.
mean, hypnosis works by so many different mechanisms when you're talking about the mind, and probably the easiest way to think about it, for me anyway, as a physician, is anatomically. I'm into the anatomy, so I look at the anatomy and the structures that are involved in hypnosis, and we can see these on imaging studies like functional MRIs. And then I also look at another way that I like to look at the way the hypnosis can affect the brain is through, I mean, something that people are familiar with is the placebo effect, or because that really gives us an indication as to how the mind can be affected by thought process. So, you know, and all of this ties into mind-body connection. I mean, we talk about these things all the time. They're thrown around in the media, and everyone's familiar with these, but they're all related, and they all fall back onto the one premise about how the mind can affect the body, how hypnosis um, is not mind control, but the thought processes that we have control our mind. So I'll give you some examples. And I like placebos. I just am fascinated by all of that. And so in general, when we have a thought, let's say a stressful thought. A stressful thought is because we have some emotional response to something that happens. We interpret it a certain way and we have a certain stress response. That stress response puts out chemicals in our body. We're all aware of cortisol and epinephrine and all the stress hormones, the fight or flight hormones. And so all these things flood our body and they go out and they have effects in our body. Our heart rate races, we breathe quicker. We're aware of those things. But there are other things that happen, which I think are fascinating. Um, for example, does a thought process affect the body? If you create stress in your mind, you can create calmness in your mind. You can create confidence in your mind. This is how we use hypnosis. So using stress as an example and showing how all of these chemical mediators that I just mentioned spill out into the body, you know that people talk about hair loss, people talk about gray hair um, caused by stress. Well, there's biochemical reasons for that. We have stress in our body, cortisol epinephrine releases, it goes to the hair follicles, they release the hair through a chemical process. Stem cells, which are in the scalp responsible for hair color, migrate away from the hair follicle and don't produce color during times of stress. So, is there a mind-body connection? Absolutely. I mean, even fertility, right? Menstrual cycles, ovulation, sperm count, all those are affected by chemical releases of stress in the body. People have the way we smell, our breath, our sweat is changed by the chemical environment of our body, which is determined by our mood, our stress level, our anxiety. So service dogs, like for patients or for people with PTSD or when they experience increased anxiety, their service dogs sense that. How do they sense it? Because the people smell differently to the dog. Why? Because during periods of stress created by the brain, releasing chemicals in the body, changes your breath, changes your sweat. And it's something called volatile organic compounds, which we don't have to get into. But the chemical environment that we're marinating in, which is induced by a thought process, changes the chemistry of our body. And these dogs pick it up. So stress can change the way you smell. Stress can change your breath. So back to your question, is hypnosis mind control? Hypnosis is really um, a way of thought. It's a focused attention on an idea. Um, and in that focused attention, creating a movie in your mind of what you want to achieve or not achieve or avoid or go towards, you're changing the chemical milieu of your body and creating change downstream. So, long answer short, yes.
Oh, so I agreed. So why do you think that working with the subconscious mind can change things more quickly than simply telling yourself to calm down or telling yourself you want to change in an area? Why do you work with patients subconscious?
A couple of reasons. I mean, the only way that I think the only way you can change an issue, I was going to say a problem, but not a problem, the only way you can change an issue is to approach that issue at the same level in which that issue was created. So, a subconscious, something happens in life, and we develop a fear of dogs. You don't know where that fear came from. You don't know how it developed. It may have been when you were 3 years old and you were walking down the street and turned the corner and the dog surprised you. It was a friendly dog. It had no mean intentions, but it scared you. And that just got locked into your subconscious with fear. Bad example, but that's the example I came up with. And now down the road, you're an adult, you're afraid of dogs. You can't you can't change a subconsciously implanted fear, thought, idea from a conscious approach. You can't logic it away. We've all tried to explain things to people till we're blue in the face, and it's not going to change the situation. You need to approach a subconsciously planted idea at a subconscious level. So you have to go back in, get into their subconscious, and rewrite that story or reinterpret the story.
Yeah. So that dog example actually is very common, the fear of dogs. And it can happen in a split second. And people think that, for some reason, people think that something that seems to be traumatic, like, an event plus a big feeling equals memory. And they think that to unravel that, it's going to be it takes so much work. But it can be done as quickly as that feeling was implanted, really.
Just
Yeah.
realization.
Yeah. So I'm assuming in the ER, when you work with your patients, there's a lot of pain management. Is that a lot of it, or are there other interesting things that
There's
you?
a ton of things. I tend to focus mostly on relieving pain, relieving discomfort quickly, and bringing down anxiety. And I mean, they're not one and the same, but bringing down the anxiety will also often bring down pain. I mean, pain is a multifactorial experience, and it's both physical and emotional, right? All pain is physical and emotional. Um, Obviously there's the physical component of pain. You get, stabbed or you get cut or whatever it is, it hurts. And those pain receptors or the pain impulse goes up to your brain and registers in your brain. And so you have a physical location of where that pain is and an intensity level. But you also have the emotional component, all the pain, the signal that's telling you, oh, my finger hurts, I slammed it in the door, that's wrapped up um, in emotion. It's got an emotional overlay, and that emotional overlay is born out of kind of our past experiences of life, our life's experiences, both for ourselves, what we've experienced in life, and what we've seen other people experience, and people that we model activity after. So life's experiences all come into play along with the actual physical injury, and together that forms the pain response. So if there's a lot of anxiety and stress over an injury and concern or fear, this injury is going to kill me, this injury is going to maim me, this injury is going to leave me disabled. These are real stressful things that people are going through in the emergency room or in the hospital, even after surgeries or cancer diagnoses, things like that. If we can bring down that level of anxiety, then that's part of the pain response. If the level of anxiety goes down, then the pain comes down. The overall effect is to decrease the pain. So I use it for pain. I use it for anxiety. Um,
And I don't know. I feel like a hospital environment could be it could heighten people's natural suggestion. and their suggestibility. Do you find that?
I mean, probably there's no doubt. I mean, for people that are hypnotists that are listening, I mean, one of the things we learn is that authority is one of those things that helps hypnosis happen. And sure, being in a hospital is a great place to maximize that authority, and it helps the hypnosis. There's no doubt. Um, I'm probably not really a great hypnotist. It's just the authority, and the people are laying in bed. They're not feeling well, and I even positionally, they're laying in bed, and I'm standing over them. I've got a white coat,
Mm.
and that has to help.
Do you tell them I'm going to use some hypnosis with you, or do you just kind of weave it into your protocols?
So the answer is yes. I do tell them, but I broach the subject gently because some people want no part of it. It's just woo woo and hocus pocus and just get out of here. And that's fine. I've got morphine for that. That's okay. Um, no problem. But for those that would like a different approach, then yeah, and I feel them out. I ask, what do they do in their hobbies? What do they do? Do they exercise? Um, do you do yoga? Do you meditate? I don't know if you could hear that barking. That's another hypnotic subject I have, barking like a dog. Um, so, I'll find out their hobbies. I'll find out what they're into. If they're into yoga and meditation, they're probably going to be more receptive to hypnosis.
Yeah.
You'd be surprised. I mean, it's all over the board. So I'll just ask, hey, you want to try a little exercise with relaxation? Have you heard of hypnosis or guided meditation? Maybe I'll call it that sometimes. And I can count on less than fingers on one hand the number of times people have said no, they're not interested. And people want relief, they want comfort, they want relaxation.
Yeah, and yeah, once you've experienced it, it feels good. So here's a question: is hypnosis measurable in the brain? Can you measure it and see what's happening during hypnosis, like MRI, that kind of thing? Other than just obviously, it's measurable with people's personal results.
Yeah, so it's an indirect measurement. So there are lots of studies, you can look them up anywhere, just Google it, but there are lots of studies on functional MRI scans. So functional MRI scans they light up differently when different parts of the brain are active. And it's something called BOLD for those that are interested. It's a blood oxygen level dependent signal. So it's an indirect measurement of the activity of the brain. So in hypnosis, there are certain brain areas that really get activated. For those that are into the anatomy, there's the prefrontal cortex, there's the anterior cingulate gyrus, there's the insula. Those are kind of the main areas. Everyone knows the amygdala, fight or flight, all those kinds of things. And we can see, and for me, in terms of pain, it's the somatosensory cortex. It's the part of the brain that registers what part of the body is being touched or injured.
Hmm.
So if you look at the brain on MRI, we'll see, if I touch my hand on this side, I'll see the part of the brain related to my hand start to light up. It lights up on both sides for some as well, but you see it lighting up. And the more intense the sensation is, the more it lights up. It's because more blood flow is going there. So when there's activity in the cell, that cell needs more oxygen because it's exerting more energy. So when it needs more energy, needs more oxygen, more blood flow goes to that cell, goes to that region. And what we're doing is we're tracking the blood oxygen level dependent signal. We're tracking the blood flow, and that blood flow results in a brighter signal. So it looks like and it's related to more electricity in that area. There's more activity in that area. So that's what we're seeing. So yes, we can see it functionally in the brain. And when we hypnotize people, we can see areas calming down. So the anterior cingulate gyrus, that's a main center in the brain, and that's responsible for like the emotional aspect of pain, the affective component of pain, the whoa, oh my God, this is killing me kind of part of pain. All right. And I don't even know if there was a Buddhist saying that you know, uh, we all experience pain, but we don't all have to suffer. And the ACC, the anterior cingulate gyrus, is the suffering component of pain. And in hypnosis, we can, as some have said, filter the hurt out of the pain, take the hurt out of the pain. You're still aware of the sensation, but the bother, you bring down the bother level. And we see blood flow, we see the MRI scan, there's a signal in that anterior cingulate gyrus, and all of a sudden we see it going down. So it's absolutely measurable. We can see it, we can track it.
It's interesting because you want to take away acute pain. You want to manage pain because I think people heal quicker when you manage the pain. In some instances, though, you don't want to take away the pain altogether because it's a signal that something may be wrong. So, but in your setting, I think it's a lot easier for you to take it away because you have other things that you can measure and see what's going on with them. I want to, yeah.
I
What would
agree,
you say?
agree.
Yeah, yeah. Um, you just finished a book, and I want to hear a little bit about your book and what's your focus and
So the book is finished. It's at the editor. Hopefully, it'll be coming out in the next month or so. It's called The Pain Illusion, and it is not that pain is an illusion and that it's not really happening, because pain is real. But it's the idea that people misunderstand pain, and again, they think pain is in the location where they see the injury. I cut my hand and people think my pain is right there. Ouch, this hurts. But pain is an illusion in that all pain is generated in the brain. And that's the grand illusion is that pain is in the brain. It's not in the part that hurts. And because it's in the brain, we can affect it with things that can change brain function, hypnosis. And it's about hypnosis. The book's about hypnosis, talks about hypnosis, talks about the parts of the brain that are affected and changed in hypnosis and how one can go about creating those changes. Um, the second part of the book is an algorithm that I came up with called the homunculus protocol for acute pain management. And it draws from many different areas of hypnosis. I didn't invent these techniques, I just put them together in a certain order. And this is what I use in the hospital. This is what I use with patients. This is what I use in people with acute pain right in front of me, waiting for pain medications to arrive. And I can do this induction quickly, 6 minutes, the whole thing start to finish. If I want to do the abridged version, it can take 6 minutes. And people are feeling so much better. So the book is about how this came to be, um, examples of who I've used on patients on whom I've used it in the hospital. And then the last part of the book is the actual protocol, the step-by-step protocol, how to do it for yourself, how to do it for others. Um, so I'm
so
excited.
so people can get the book and just teach
People
themselves
can get
the
the book,
hypnotic
teach
technique.
themselves, read through it. The first part of the book is kind of the psychology of pain, why we feel it, how we feel it, how things come to be for us. And then the second part of the book is the protocol step by step. Each chapter is a different step. Some of the chapters are just a couple pages, but it's just the step by step protocol of how to take care of acute pain. There's some mix over with chronic pain. Acute pain is different than chronic pain, but there's crossover. And I've had people use this for chronic pain, and it reduces the sensation in the moment.
How did you discover hypnosis originally? How did you get into it?
I was 12 years old, and I was at a party at my parents' house, and they had a magician, hypnotist there, and he did an eye lock, and nobody's eyes stuck except mine. And I was sitting there with my eyes stuck, and I just thought it was the coolest thing in the world. And I said, I just have to learn how to do this. And then life went on, and I forgot about it. And, whatever, 25, 30 years later, after I had finished medical school and residency, and I was sitting around and thinking, hey, I want to go back and do this hypnosis thing. And I happened to go to a stage show, stage hypnosis show, and it kind of reminded me of everything that happened. And I just said, wow, I got to learn how to do this. So I started looking into hypnosis classes and took one and another and another and another. And oh my gosh, I just took tons. And I just went down the rabbit hole and started applying it to um, patients in the hospital. I started doing some hypnotherapy. Then I branched out and I started doing stage hypnosis shows, which I did for maybe 12 years. And then I started bringing the stage hypnosis techniques to the bedside because they were quicker, so to speak. Um, and I just joined hypnotherapy with the stage hypnosis at the bedside in the hospital, and it just worked. So,
It's so cool. I got into it too through a stage hypnosis show.
oh
That it was it for me. I saw that and I thought, if you can change your state so quickly, if you can change things so quickly, I'm going to learn this.
yeah, absolutely.
It's so cool. Thank you so much, Bill, for all the info. I'm going to link.
Oh, absolutely.
Yeah, I'll link once your book. I know your book's at the editor. It's not out yet, but when it is, I'll link it here and people can
Awesome.
go check it out. But thank you so much.
Thank you. Appreciate it. Thank you.
Yeah.